Hello, hello, and welcome back. This episode is the third of the Blood Sugar Basics series, and today we are digging into how insulin works in the body, insulin resistance, and metabolic syndrome. So, in our last episode, I shared the path that the carbohydrate rich foods we eat and how they go from our mouth chewing into their digestion and absorption into the bloodstream as glucose. We covered the sources of carbohydrates, simple sugars, complex carbs, and all that, and how other factors influence absorption rates. In this episode, we will discuss the basics of how that glucose, the basic component of those carbohydrate foods, gets transported into the blood and into your cells. Central to this conversation is the hormone insulin. So first, I want to say this explanation is going to be really basic. Think of this as a first pass explanation. And by first pass, I mean, this is the first time you might be learning this. Remember, the series is for people who are really new to this. It's best to keep it really simple so that you can get the general idea of how this works. So we're skimming the subject matter. I mean, I'm going to try to go into detail, but think of it as a skim to create that structure, the scaffolding that your brain can then hang new information on later. That's what this is for. So for those of you who already have a more advanced understanding of this process, you'll likely find this explanation overly simple and this episode might not be for you. So I'm going to do my best to straddle keeping it simple with being accurate. But please treat this information as a primer upon which to hang more information on later as you continue learning. So here's what I hope that you will take away from this episode. You'll understand, what does insulin do in the body? What is insulin resistance? How do we measure it? How high insulin impacts other things in the body besides just your blood sugar levels? What causes insulin resistance, and a little bit about how we can reverse it. So with that introduction and disclaimer, let's dive in. And I think we need to start with a premise that no matter what kind of carbohydrates you were eating, it's either been broken down or converted to glucose now, and it's entering your bloodstream. So when we say blood sugar, we mean blood glucose. We're just talking about glucose. I know that we talked about all the other monosaccharides, fructose, galactose, like what happens to those. That's nutrition 201. We're sticking with the basics, just glucose. But I don't know, this is kind of a basic question for you, but if you're watching all of this on your glucose monitor, let's say you have a continuous glucose monitor or CGM, you know that when you absorb the glucose from your digestive tract, your glucose levels start to rise, but eventually the glucose levels go down. Have you ever wondered why or how they go down at all? It's kind of a good question. And it goes down, in essence, when that glucose gets into your cells. Because really, that's the whole thing. You need that glucose to go into your cells so they can help your mitochondria, the powerhouse of the cell, to produce electrons to make energy, or ATP. ATP is, the energy currency of every single cell in your body. And it might be helpful to side note here, that we can use fat to do the same thing. Our mitochondria, if healthy, are adept at using either glucose or fat as a fuel source, probably more fuel sources. But today, just talking about glucose. Now, when you think about glucose going around the bloodstream, getting into all the cells in the body so that they can all make the energy that they need, some of our cells, like our brain cells, can take up glucose all by themselves. Glucose floating by, we'll take some, thank you very much. But other cells, like our muscle cells and our fat cells, generally need the help of insulin. You see, muscle and fat cells have insulin-dependent glucose receptors. And this means that insulin acts like a key that sort of opens the door of your muscle or fat cells to let glucose in. Side note, if you listen to earlier episodes, you'll remember that muscles can also take up glucose independently of insulin during exercise. But let's set that aside for now, and we're going to focus on the insulin-dependent glucose uptake. Glucose concentration in the blood, or blood sugar levels, is one of those things, as I've said before, that our body likes to control in a certain range. We call this homeostasis, just like it does with temperature or pH. The body likes the blood glucose concentration to sit somewhere around 80 to 95 milligrams per deciliter, from the looks of it, as this is where it brings it back to after a meal. It brings it back down to that range in a healthy person. And then it works to keep it up to that range between meals while we're fasting. So that's its Goldilocks zone. If the blood sugar goes too low, that will cause problems immediately, unconscious, fatal. And when it goes too high, you will start getting permanent damage to places like your eyes, nerves, kidneys, and blood vessels. So we want it in the middle, baby bear, just right. That's why I call it the Goldilocks zone. So let's talk about how insulin works. Here's the system. We eat carbohydrates. Again, we're simplifying this. 1, we eat carbohydrates. Glucose gets absorbed into the blood. Various signals cause insulin now to be released from the pancreas into the bloodstream. The pancreas secretes insulin. That insulin sort of escorts, think of it as escorting the surplus glucose that you have in your bloodstream into fat and muscle cells, like storing it away, until it brings the glucose levels back down into that Goldilocks zone. Insulin helps store excess glucose until later. Those muscle and fat cells are temporary storage depots. The muscle and fat cells are temporary storage depots for the excess glucose that you have in your bloodstream after a meal. Then, glucose returns back to the Goldilocks zone, that baseline fasting glucose level. And then that insulin, it just drops down to super low baseline levels, barely there, basically not there. Now, as the hours pass between meals and insulin is practically non-existent, that lack of insulin lets the body now liberate some of that energy that you've been storing in muscle and fat cells and liver cells, and it takes it out to keep blood sugar levels up, because all your cells are still like, I'll take some glucose, a little glucose here, a little glucose there. And so it needs a steady supply. And so it's now releasing some of that stored energy, from your fat, muscle, and liver cells. And this is what keeps your blood glucose from dropping too low overnight when you're fasting or whatever. And this is what we mean by like burning fat. You're burning fat or whatever to make energy, feed your mitochondria. And this cycle repeats again and again and again. So we, as humans, as mammals, toggle between storing excess energy after meals and burning, I'm using air quotes to you on the podcast, we're burning stored energy between meals while fasting. Remember, I'm keeping this overly simplistic for a reason. But sometimes, this is when things start going pear-shaped, sometimes the muscle or fat cells can become less receptive to insulin for a few different reasons. But a simple one that happens is they might just be full of energy. They might already have a lot of energy stored in them, that muscle or fat cell. And when this happens, if insulin comes a knocking to say, I've got some glucose, could I just store it in here for a little while until we're hungry? Those cells don't want it anymore. They're like, no, we have enough. Thanks. Go away. These are now insulin resistant. Yeah, no soliciting, no vacancy, go away. But we still have glucose levels rising. Like glucose levels are high and our body's like, we need somewhere to put this glucose and we don't know where to go. So could someone just take the freaking glucose so we don't cause damage to the rest of our body? So if it can, now the pancreas will secrete more insulin. Yeah, so higher levels of insulin until the cells finally are convinced, I'm, personifying this, the cells are finally convinced, forced to take up that excess glucose and the blood levels come back to normal, right? So I have two analogies that this reminds me of. And the first one, this is for you Harry Potter fans out there. I always think, if you remember the first book of Harry Potter, when the owl post is trying to deliver the Hogwarts invitation to Harry, and one owl comes in and tries to deliver a letter to Harry, but Harry's mad aunt and uncle won't let him have it. And so the next day, another letter comes and another. And eventually, hundreds of owls just bomb the house. And all these letters, hundreds of letters, just flood the house so Harry can get a single invitation. So Harry's house is owl resistant. And it resulted in hyperowlemia, a lot of owls required to get that single thing in there. So just like that, the cells can become insulin resistant. And because of that, it creates hyperinsulinemia, super high insulin levels, in order to counteract that. Another less Harry Potter version of that is to think of packing your suitcase. So I love a good analogy. I always think of, if I'm going to go to a 3-day conference, like I just went to a conference that was 3 days long, I plan and I pack my suitcase and I'm very sensible about it. And I pick a piece of luggage that's just right and it closes. I'm good to go. But always, every single time I travel, in the hour before I'm ready to leave, I have a panic attack and I decide I need more shoes than I packed. So I open my suitcase up and I put more shoes and maybe a cute jacket and some snack, or, I panic pack. And now my bag is hard to shut. I can shut it, but it requires sitting on it in order to close it. So my suitcase is shoe resistant. And I have to add extra force to close it, which is, it's the same kind of thing. I think you get it. So in the early stages of this insulin resistant, back to actual physiology, in the early stages, your glucose levels might not look much different on your labs. Certainly your fasting glucose will be fine because by the time you wake up and get to the doctor's office, everything will be fine. Even your A1C might not be that much different. But if we had a continuous insulin monitor, which we don't, we might see insulin levels compared to before might be higher and they would stay high longer. And this is hyperinsulinemia resulting from insulin resistance. But insulin resistance can actually happen for other reasons besides just overeating and under-exercising or whatever. And one reason is high cortisol levels. Now, cortisol is a stress hormone, and it's good. I don't want to vilify cortisol. Like if you don't produce enough cortisol in the morning, you would feel like crap, and bad things would happen. But chronically elevated cortisol, or like elevated cortisol in the evenings that keep us awake, that comes from chronic stress. It comes from poor sleep, and it can come from using corticosteroid medication, also known as taking steroids. Low thyroid function can also be a cause. And some other people have genetic causes for insulin resistance. That makes me think of polycystic ovarian syndrome. It's common there too. So there's other reasons you can have insulin resistance. And over time, this insulin resistance can lead to elevated blood sugar. But the elevated insulin comes first, and it causes its own problems. I mean, just in case you're thinking, well, who cares about elevated insulin? I'm only going to be worried when the blood sugar goes high. Chronically elevated insulin levels lead to their own issues. I'm going to list them here for you. Here's the big one, literally. When your insulin level is chronically high, it causes you to add more visceral adipose tissue. Some people call this belly fat. Most people call it VAT, visceral adipose tissue. This is the type of fat that lives around your organs. It is not the pinch and inch fat. That's just cosmetic fat. The VAT, the visceral fat, lives like in and around your liver and pancreas. And when you get fatty pancreas, it actually impairs the function of it, making it not be able to produce insulin very well. This type of fat also is like an inflammatory organ releasing inflammatory cytokines. So increasing inflammation in your body. So increased pain. If you have an autoimmune disease, it gets worse. So you'll also see the size of your waist increase with this, in addition to your levels of inflammation. So if that's not enough, chronically high insulin also leads to high blood pressure, elevated triglycerides, can lower HDL. It lowers energy, causes brain fog, more cravings, and of course, increased risk for type 2 diabetes and cardiovascular disease and all that. In fact, this collection of symptoms has been given a name, and the name is metabolic syndrome. So, this elevated insulin is the root cause of a lot of things we see. And you can test for it. You can test for it, but sometimes you don't need to. And there's some very good indications of it, which I just listed. But, clinically, when I see elevated triglycerides on a lipid panel, I'm always thinking that's elevated insulin, especially if it's consistent over time. If I see an increase in visceral adipose tissue, and you can see that on a DEXA scan, sometimes on an in-body scan, but, just monitoring waist circumference is a really good indicator. I feel pretty, and if I see some of those other issues, especially if A1C is creeping up, I feel pretty confident that high insulin is at the root. But there's ways you can test it. You can do a fasting insulin test. I think it's about $20 in a lab. When I look on Jason Health, they charge $20 for that lab. So it's not cost prohibitive. So you might already logically be thinking, why am I not getting a fasting insulin done? Because a fasting insulin is probably going to come up before a fasting glucose would in the progression of metabolic disease. And I would agree. You can also, the old test, which is still valid, an oral glucose tolerance test, where you drink that little glucose liquid, sit in the lab for 2 hours, and get your blood tested every 30 minutes to check for your glucose. That's a really handy test, which you don't need as much because we use continuous glucose monitors. But if you get that lab and also test insulin, it's a very nice way of looking at what's going on under the hood in terms of, why is my blood sugar going so high? Is it because I don't produce enough insulin or delayed insulin? Or am I producing plenty of insulin, but I have such insulin resistance that it's not making a difference? So those are really handy tests that you can do. But I want to emphasize that elevated fasting glucose can be the last thing to show up. With some people, by the time you see an elevated fasting glucose, you might have had high insulin for years. And all the things we do to manage glucose levels, blood sugar levels, will help in lowering insulin. In fact, this frustrates me to no end, but it is what it is. When some people use continuous glucose monitors with me, and they have all the signs of metabolic syndrome and blood sugar issues, their glucose levels look fantastic, enviably fantastic. But when I look at all the other things, I see they have all the signs of high insulin levels. And I generally assume that their pancreas is just cranking out the insulin and managing things. And that's causing a lot of their symptoms. And I know that keeping a tight range, keeping their blood sugar tight and eating for good balanced blood sugar is going to help, along with other things that improve insulin resistance. But that's also when I know that a CGM might not be the best metric for them to be tracking. Like I said earlier about the oral glucose tolerance test, the insulin resistance is not the case for everyone. Some people, as I mentioned, might have a suppressed or delayed insulin response causing their high blood glucose. And that's where an oral glucose tolerance test can come in and help, and there's ways to improve that. But if insulin resistance is causing it, then the insulin's been there a whole long time, and that's why it's nice to add on that fasting insulin lab for about $20. So now you might be wondering, what do I do about this insulin resistance? Once you've determined that you have insulin resistance, you want to know how to improve it. And the lingo we use for that is improving your insulin sensitivity. How do we make your cells more sensitive to insulin? How do we make them hungry? Like, yes, I will have some of that glucose. Thank you. Come on in. It's not as straightforward as you think. Because, of course, as you might be thinking by now, it can depend on why you have insulin resistance and high insulin in the first place. For many people, garden variety, what you'd always assume is it's really because of how they eat. If a person's been eating too many carbohydrates, especially simple sugars, relative to their activity level, they have a full suitcase, right? And by using a CGM to show what, lowers blood sugar, they can keep it that way and keep insulin lower. And then at the same time, they can increase demand. It's a supply and demand answer. This is a simple one. With the right kind of exercise, they can increase insulin sensitivity. Exercise is probably the best way to improve insulin sensitivity in most people, and it makes about 20 million other things better. So that's one. It's just straight up supply and demand. Fewer carbohydrates, more exercise. But remember, there's more other causes. Another way of dealing with insulin resistance, especially for these people, is building muscle. Just focusing on building muscle. Over time, most adults find they lose a lot of muscle mass. And when they do, they also lose their insulin sensitivity because those muscles, that is your glucose sink. That's a lever that you can pull. When you have more muscle and it's active and you've been using it, it wants all the glucose, lots of insulin sensitivity. But this is it's common in people, especially who've been chronic yo-yo dieters. If you've been dieting periodically throughout your life, every time you lose weight on a caloric restriction, unless you're really careful, you're going to lose muscle. And then, of course, you gain it back, that weight back again, the pounds. But a rare person puts that back on as muscle. You've probably put all that weight back on as fat, not muscle. So you have had a net loss of muscle and a net gain of fat, which not only looks less appealing in your swimsuit, which is not why we're here. What it does is it makes you more insulin resistant. The loss of muscle makes you more insulin resistant. So as you get older and you go through cycles of either being sick, inactive, losing weight, you lose muscle and you become progressively more insulin resistant. And that doesn't have to happen at all. So the excellent strategy is to focus on building muscle, at least maintaining it. And so for those of us over 30, of course, this is a whole nother podcast and discussion. We need the right kind of muscle stimulation and the right amount of protein at the right time. And this is why you hear, in a nutshell, this is why you hear so much of us banging on about getting enough protein. If you can keep your protein up and give your muscle, the right kind of exercise, it helps maintain your muscle mass. A third strategy, and really, it all depends on the cause of your insulin resistance, but another strategy is by addressing your stress and or sleep. Remember, for some people, it's not food and exercise. Insulin resistance can just be caused by increased cortisol levels due to chronic stress or poor sleep, like sleep. It could just be sleep apnea. That's all it takes. And if you have sleep apnea and we determine that is going on and you're kind of doing everything else okay, I would not waste your time on anything else other than sorting out your sleep. And now it's true that I find regulating your blood sugar helps you with sleep. So, you can focus on a few of these. But, when I see blood sugar levels, which, and I'm like, wow, Diet C doesn't seem to be affecting it, but there's chronically elevated blood sugar levels. And I know someone snores. We have a sleep study, and addressing the causes of that poor sleep is the way to go. And reducing stress, which isn't easy, but there are concrete ways to lower our stress and cortisol levels. So that is definitely a strategy that needs to be employed. And then, there's lots of other ways to improve insulin resistance that have worked for people. There's supplement strategies, medications, even specific to their needs. And I'm not going to go into all those, but, it's the exercise, it's eating the right amount of carbohydrates, pairing with your needs for that, improving muscle, stress, and sleep, and sometimes some supplements, and sometimes it's nutrient deficiencies, adding the right nutrients that someone needs. And I'll add lowering inflammation. High levels of inflammation will also cause some insulin resistance and elevated blood sugar. So identifying that and lowering inflammation, which again it's one thing to identify, yes, you have high levels of inflammation. It's another thing to figure out why and then to lower them. But again, it doesn't make sense to, embark on a strict fasting routine if the cause of your inflammation is, say, dysbiosis in the gut or some chronic infection, right? You would need to address that cause. If you want to learn more about this, I kind of wanted to touch on the basics of this, but if you're thinking, wow, this kind of sounds like me, I'd like to learn more. And do you have any reference for this, Karen? Yes, I'd love to share this with you. In the description of this podcast, I will put a link to my blog post called Understanding Metabolic Syndrome. So that'll be in the description for you to see, and you can go to that and get those resources. So I think this is as good a place to stop as any for the explanation of what insulin does in the body and how it leads to metabolic syndrome, insulin resistance. And I hope that by listening to this, you've gained a better idea of how glucose and insulin work in the body and the role that insulin plays in both insulin regulation and as the driver of many of our chronic health issues today. And maybe you've seen a little bit of yourself in here and thought, oh, I have those things. I wonder if it's high insulin. Then I encourage you to, check out that blog post or even go to my link. And if you want an appointment, I'm taking new patients and I would love to talk to you. You can book one of my free calls to see if I'm a good fit for you. I'd love to talk to you about that. But for now, I hope this was helpful and thanks so much for listening.